Can I come in?
Yes.
Hi, Mr. Underwood. How are you?
Doing well, how are you?
Good. What's your first and last name and your date of birth?
Parker Underwood, 5197.
And can I just see your wristband? Awesome. Perfect. My name's Jasmine. I'm your nurse today. I'm just here to do your skin assessment. Do you have time for that right now?
Yes.
Awesome. Should take only 10-15 minutes most.
Mm-hmm.
I'm just here to look through the skin, see what's going on. Do you have any questions?
No questions.
Can I take a seat next to you?
Yes.
Awesome. Mr. Underwood, do you prefer Parker or Mr. Underwood?
Either or.
And then do you have any pronouns that you use?
No.
Okay. All right, Mr. Underwood, I'm going to go perform some hand hygiene, and then I'll be right back, and we'll get started with your skin assessment, okay?
Okay.
Awesome. So, tell me a little bit about your skin history. Any family history of skin cancers?
Not that I'm aware of.
Not that you're aware of. Any concerns today on your skin?
No.
Anything that's changing, growing?
No.
Anything bleeding on its own?
No.
Anything evolving?
No.
Nothing like that.
Nope.
All right. Any issues with nails, nail diseases, any history of that?
Nope.
Any history of any rashes, chronic rashes like eczema, psoriasis?
No.
Any rashes present today?
No.
All right. You're making it too easy for me. Any bruising?
No bruising.
No bruising. All right. Are you taking any medications?
Just occasional Tylenol, but
Okay.
that's it.
Okay. No problem. And do you wear your sunscreen?
Yes, I do.
Beautiful. So, I'm going to go ahead and start at the top. I have a little systemic method, so just stick with me. If you have any questions as I'm going about lesions on the skin, you can just ask, stop and ask. If I see anything suspicious, I'll let you know, but are you ready to go?
Yes.
Awesome. So I'm going to start with your hair. I'm going to look through it, make sure there's nothing abnormal growing. I don't see any flaking in the scalp. Hair color is normal. Patient just took a shower, so it's a little wet. No odors. Like I just said, patient just showered, so everything looks good on the hygiene end. His hair is looking good, equal distribution. Nothing I'm concerned about in terms of alopecia or anything like that. Patient's looking good from the hair perspective. All right, so I'm going to start with the face, and I'm going to move down, okay?
Okay.
How are you doing today?
Doing well, how are you?
I'm doing well. What are you doing for the rest of the day? Anything fun?
No, just hanging out with my kids.
Your kids? How many kids you got?
Just two.
Just two. Assessing for symmetry. Any issues with that? I don't see any issues on the face. Two kids, boys, girls, what do you got?
One of each.
One of each. Lucky man, huh?
Very blessed.
Very blessed. Always ensure to check your ears when you're doing your skin assessments. So it looks like you got a couple moles and a couple sunspots on the face. You said you wear your sunscreen?
Yes.
What SPF do you wear?
Usually 30 is the lowest
Okay.
I use for my face.
All right. So with sunscreen, it does stop working after 2 hours. So just make sure to reapply so that you protect yourself from the sun.
Okay.
All right, we're gonna start with this hand. I'm just gonna look. After I do both arms, I will do the nails. I will palpate, just checking for any bumps, lumps, rough spots. Patient has a cafe au lait on his arm, couple nevi. Nothing I'm concerned about. Little bug bite. Did you get bit by a bug this week?
Yes, the mosquitoes have been really bad by my house.
Yeah?
So.
Yeah, mosquitoes like me too. Patient is tan. I'm going to note that as well. Don't feel anything rough. Nothing I'm concerned about. Same thing like the other arm, some nevi, cafe au lait. He does have a tattoo on this arm, so I would note that. I'm going to look carefully in the tattoo because certain things can grow in there. When did you get this? This is beautiful.
A couple years ago.
Nice.
Thank you.
You're welcome. It looks great. So nice. All right, we're gonna check your hands before I move on anywhere else. We're gonna just take a look at your nails. Palpating the nails. The nails are normal in color. Texture is smooth. Shape is to be expected, normal. Not concerned about anything with the nails. In terms of his arms, back to the skin, moist. No real issues, no real lesions that I'm worried about. I did take an education moment to tell him about his sunscreen. Once I look at his back, that's when I'm going to talk to him about the A, B, C, D, E, F's of moles. Is it okay if I lift your shirt up before I move on to your legs?
Yes.
Going with the patient's chest, I'm going to check the unexposed areas. Looks great. And can you lean forward for me?
Yes.
Awesome. All right, so you don't really have that many moles. You are not a moley guy. Which is a good thing for you and me, right? So if you notice any changes in your moles, I want you to think about a couple things. There's nothing I'm worried about back here. Same thing as your arms. You got maybe 3 moles back here. You got some cafe au laits. You have a cherry angioma. So all benign stuff. You can take a seat back. I'm going to show you the A, B, C, D, E's, F's of moles. This is from the American Association of Dermatology. So this is kind of what you're looking for when detecting skin cancers for moles and stuff like that. So A is asymmetry. You want to see how if one side is different than the other. You want to look at the borders. If the borders are jagged or if one side is, smooth and the other one's not, that's something to bring to my attention. C is for color. So if there's multiple colors in one lesion, that is something that, again, you want to bring to my attention. If it's bigger than the back of a pencil eraser, that's something, again, you want to just notice. And then E is for evolution. So if you notice that your mole, used to be round, brown, and normal, now it's round, brown, pink, purple, and black, again, something to be concerned about and just bring it up. And then F is if it looks funky. So if it looks like we call it the ugly duckling. So if all your moles are brown, round, and normal, and then this one is funky looking, that's something to bring to our attention.
Okay.
Here's the education tool that I use, just so you guys can see it. Awesome. Wow, this is the longest skin check ever. Sorry, guys. All right, we're gonna check your legs now. So I'm gonna start with this one. That's funny, you can't see that. Nothing. Do you do self-assessments at home?
Yes, I do.
Awesome. So just be careful in that tattoo. You really want to pay attention to that. You don't want to have anything growing in there. So just be super, super cautious about that.
Okay.
All right, I'm gonna have you stand up just so I can take a look at the back of your legs.
All right.
You just turn away from me, please. Thank you very much. Legs look good. I don't see any edema in his legs. Again, skin feels normal. Temperature is normal. He really doesn't have that many lesions on him. The most lesions he had was on his back, which, like I said, 3 or 4. They were small in diameter, round, brown, normal. Nothing to be concerned about. Only thing I'm going to do, if you could take a seat for me again, I'm going to check your hands one more time. Just want to checking for skin turgors, see how hydrated he is. Patient's well hydrated, no notes of edema, no notes of any potential malignancies. I'm not worried about this patient's skin. This patient has nothing on his skin. And yes, so went through everything. Just double checking here. I'll edit this out. All right, Mr. Underwood, do you have any questions for me?
Nope, no questions.
Awesome, you did great. If you notice anything change, you know where to find us. If not, we'll take a look at your skin every year or so.
Okay.
But we'll see you next year, okay?
Perfect, thank you.
Thank you.